Johnny Keeley. My parents are part of WPP, so they've always been part of the organization. They help plan some of the big charity events. Because of that, I become involved as well, and I usually go to the Ronald McDonald House to play with some of the sick kids. We just do fun things like play the Wii, hang out, make food, play in the park, and things like that. And these two are some of my buddies, Robert and Will, who've also joined me in helping with giving some of the funding at the organizations and coming and playing with some of the kids.
Like his parents kind of showed me, and he showed me as well, like some of the activities that they do and like the change that they bring to like so many families. So like being in, like we go to like different charity events and we just like help out there and just try to do that because it makes a difference.
I've been helping out WPP stuff for a few years now. I've been to a bunch of events, just hanging out with the kids. It's just like, it's always something good to do. It feels good to be there for the kids when they just need someone to hang out with, kind of distract them from if they're getting a little nervous about their surgery or anything. And it's just been a great experience. I just always want to come back and just do it again and again.
For me, I have a younger brother who's also a heart patient, and it brought him a ton of joy for just us being around him, and I think that kind of just gave him the encouragement alone to keep on fighting and keep being tough and just to persevere. I think it's pretty incredible just making really long-lasting friendships with people in completely different countries that you've never met before. Maybe there's a language barrier, or there's just a lot different about your guys' lives, but you're able to kind of bond and communicate and have an amazing relationship with the people that are there, and those are things that I will cherish forever.
Hello, my name is Genevieve Williams. I'm from St. Lucia. This is my daughter, Janae Williams. I discovered she had scoliosis from the age of 14 years. And I brought her to a doctor, Dr. Plummer.
He diagnosed me. Ever since we've been doing therapy, physiotherapy with chiropractors, trying to get rid of the pain, but it didn't really help that much. So I just used to do exercise on my own. Right now I'm 19 years old and my scoliosis has developed to 60 degrees. And so I'm here. I found out about the World Pediatric project, and so far I've met with some of the doctors and they sound really good, like they know what they're about. So
do you.
So yes, and I feel comfortable so far letting them help me with my scoliosis.
Odinga, Georgina, Hall Pope, and my son is Michael Hall. By transfer him to one school to the next, I was asked to do some medical tests with him, and that's how I found out he have a hole in his heart, as we say. And then I was immediately placed with the WPP with Jacqueline King. With them doing his phenomenal, I never expect I will be a candidate for this year because I watch a lot of television and I saw a lot of people have different problems and them can't help themselves, but WPP stepped in and helped them, and I am so appreciated of what them doing for me, and I know there will be others that they could do the same as well. And this is a great program that them have going around, and it's amazing.
My name is Rochelle Roach, and I am the Chief Project Manager for the Maria Holden Memorial Trust. The Maria Holden Memorial Trust basically operates in Barbados. That's our home base, and we were established in 2009. Our mandate is basically set around working with various target groups, and right now we're here in lovely St. Vincent, where we're at the WPP clinic for scoliosis repair. Now, St. Vincent is one of those countries that we have started to work, and we have concentrated the projects that we have been doing so far in healthcare. WPP we have partnered with for the last 2 years, and we have a 3-year project with them doing various things in healthcare, and they have turned out to be a very strategic partner in terms of what they have been doing and how they have been doing it. So just being here this morning and observing the clinic, it's actually a very rewarding experience to see how people do what they do. It's okay to say that you're reading a report and you're hearing about all the good work that WPP is doing in pediatrics and working with children up to age 21, but it's definitely a different thing when you're actually here to be a part of the assessments and see what they're doing on a day-to-day basis. So that in itself is rewarding, and we look forward to continuing our partnership with WPP. We're going to have some further discussions, so it's not going to be just about the surgeries, but it's also about capacity building and seeing how else we can form partnerships. WPP has proved to be a strategic partner for the Maria Holden Memorial Trust. They have gone above and beyond, and they do wonderful work. So therefore, anyone who's looking to work with WPP, get in contact. I know they're on social media. They are out there. So get in contact with them, see how you can form alliances, or how you can even get your children involved in their program to be assessed should they have a program that can help.
I'm Horatius Jeffers, an orthopedic surgeon. I did my training over in the UK. Primary training was at GWI Jamaica. I've been working at Tapian Hospital since 2011, and I've been associated with WPP for the last 10 years or so. And it's really an opportunity for us in the Caribbean, in St. Lucia, to bring healthcare facility and healthcare in certain areas that are, for one, expensive, like spine surgery, for example, lower limb reconstructive surgery. There are expertise and facilities and equipment that's not available locally, but we can, through our affiliation or my affiliation, and along with my colleagues in the pediatric community back in St. Lucia, we are able to access that care and be a part of the WPP, and really changing the lives of so many kids and their families as well. Apart from the orthopedic component, there's some colleagues of mine who are involved with the cardiology component as well. Kids have been able to facilitate to be able to access healthcare in the States in terms of open heart surgery and things like that that would not otherwise be available locally. And even if they were available, they would be available at a tremendous cost. With WPP, you have so many volunteers and people of goodwill who contribute financially. Companies like the Orthopediatrics, for example, who give of their equipment. And of course, you have some really wonderful, talented human beings, clinicians who come from the US, who have come across and they give their time. They could have been on holiday somewhere else, but they choose to come down here for a week stint. There's Dr. Gordon, who's been involved in the organization. He's going to be here twice this year. So it's wonderful to see human beings reaching out and giving, because I believe that the more you give is the more you get. If your basket is full and you don't empty it out, then nothing comes to you. So the more you give, the more you get. And it's wonderful to see how you can impact the lives of ordinary human beings, kids. They're appreciative, they're thankful, and it's a wonderful thing to be part of that sort of project partnership between voluntary organizations like WPP and the governments. I think it's fundamental. It's showing how if persons come together, there can be so much that can come out of that creativity, that spirit of generosity, that spirit of goodwill and giving and compassion. I think that's what WPP is about, in my perspective. Of course, as a clinician, I believe that the more, to quote Brian Tracy, the more you learn is the more you earn, and the more confidence you have. So by coming along and meeting experienced colleagues, you learn. So when you go back to St. Lucia, for me, for example, I can introduce certain aspects in my practice that will benefit the local population. And I grow as an individual. I grow in terms of my skill set. And at the same time, you get to learn how to sort of share and deal with people, professional colleagues, and so on. And I must say the colleagues from the WPP, from the States who come here, they certainly do not have that spirit of condescension that sometimes you see. So you come into a third world environment. They would listen to because they understand that you're a professional as well. Knowledge is international. It's available at the at the end of a computer terminal, something called Google. If you go on that, you can information. If you have a sound training, you can access that. So these colleagues, when they come over, they're willing to share and they're willing to participate. They're willing to learn from you at the same time you learn from them. So that sort of spirit is what I really enjoy, and that's the reason why I make it my duty to sort of book those scheduled visits to St. Vincent in my calendar. Nothing stops me from coming because it has been a wonderful experience.